started.
All right. Hey, everybody. Like Maggie said, my name is Zachary. I'm the IRB ambassador. So I'm going to be walking you through this process today. And yeah, this meeting's being recorded, so you will be able to view it later if you need to. I will also be sharing this PowerPoint with you. That includes all these hyperlinks for you to make use of. So just getting started. Just an overview of what we're going to be talking about today. We're going to be talking about the IRB's purpose and its goals, any required trainings for researchers, the different IRB review types, the IRB application overview, resources to help you with that application, a little bit about the post-approval process, and then I'm going to share my screen. We're going to go through and actually navigate through the Huron IRB research suite, which is where we process the applications. And then we'll be able to talk a little bit about it and maybe get any questions answered about your specific research. So yeah, let's just jump on into the IRB purpose and goals. So basically, IRBs are a part of something called a Human Research Protection Program. Pretty much any research you've ever read that involves human subjects, most likely that research has gone through this IRB process, which it ensures that all research participants were treated in an ethical and fair manner, as well as the scientific validity of the human subjects research. But generally, as I'm sure many of you are aware of, in the past, there's been a lot of unethical research where people were treated very unfairly in order to benefit the medical or research community. And that's why these kind of things exist. So something you might hear about when you think about research ethics is the Belmont Report. Now, this is one of the many different major reports or guidelines that have come out about human subjects research. But there's three main tenets to this. One is respect for persons, so treating those participants as individuals and autonomous agents, and also making sure people with diminished autonomy have extra protections. Second, we have beneficence. This is the idea that to do no harm to participants and to overall just maximize the benefits and minimize the potential harms for those participants. And then third, we have justice, which is nobody should uh, unfairly receive benefits or experience burdens based on who they are. Now you can read up a lot more about this. It's very in depth, but just take a look at the Belmont Report. It might be a good idea for you to better understand uh, human subjects research ethics. And I have an image here. This is just an example of some human subjects research. It varies a lot what can be done in human subjects research. And you see this example here. They're actually using some equipment to measure something from this person. And this is definitely an example of human subjects research. We also have examples like interviewing people, creating an intervention for people and collecting data off that. And that's something we'll chat about again soon. Now, just jumping right into the training requirements. So, and I do want to encourage everybody to take notes during this, just noting down any of these key points that I mentioned is going to be helpful for you. So for training requirements, before you submit an application, you and all your study team members, including your faculty advisor, have to complete city training. Now, there's a caveat to this. If your thesis research is considered not human subjects research, this is one of the determinations we'll talk about next. You actually don't have to complete city training. So I know a lot of undergraduate researchers, you might complete the city training as part of coursework or something. So if you already have it, that's great. But city training stands for Collaborative Institutional Training Initiative. And we do have an IRB guidance document that goes into detail about how to do this training and everything like that, which you'll be able to click in the hyperlink of this PowerPoint once I send it to you. But basically, there's two main training groups. You have Human Subjects Research Group 1. This is biomedical research investigators. And then we have Group 2, which is social and behavioral research investigators. Now, there is some other trainings that people may be required to take, but usually this is a requirement of a department or something like that. The IRB only requires this city training in the human subjects research groups. And it's one or the other, depending on your research. Now, jumping into the first category we have, the review level, we'll be starting at the bottom and moving up. And when I say bottom, I just mean like sort of like the lowest review level in terms of risks to participants. But sometimes you might see the acronym NHSR. This stands for Not Human Subjects Research. And this classification is for research that doesn't involve human subjects, so like living individuals, or is not considered research. And when I say that, I mean like the federal definition of research. So basically, a project is not human subjects research if it doesn't meet the following criteria. So, is it research? If something is considered research, it's a systematic investigation and it's designed to develop and contribute generalizable knowledge. Now you can see I put generalizable in all caps. It's because that's a big factor of whether it's like considered research. Another thing is, does the research involve living individuals? So this can be like physical procedures or manipulations of a person or their environment specifically for research purposes. It can also be communicating with participants, contacting, collecting identifiable data, or any interactions with them. And this could include online interactions like surveys for research purposes. Now, if your research or if your project doesn't meet either of these definitions here, it's probably considered not human subjects research. And I have some examples of what might include. Sorry, I didn't mean to go forward there. I have some examples of what might be included in not human subjects research. So for one thing, if it doesn't involve living individuals and it's with existing de-identified data or biospecimens. So when I say existing and de-identified, I'm referring to the data set cannot be traced back to the individuals in it, and the data does not require consent because it's already been collected. So in that case, the research would not involve living individuals. Now, there's other examples for categories that don't meet the definition of research, like we talked about. And this would be like a case study, quality improvement project, or a program evaluation. The main thing is here, you have to call into question whether these examples could be a systematic investigation or contribute generalizable knowledge. Usually case studies, quality improvement projects, program evaluations, they're kind of restricted to the setting. So it's not necessarily systematic and it might not contribute generalizable knowledge. Now, for research that falls into this category, there's a template form. You're going to see at the bottom of each of these pages, there's a template form, HRP 250. The numbers don't really make sense, but they will once we get to looking at the actual Huron library. So yeah, that's not human subjects research. Now I'm going to continue. The next category up is exemption. So this is for research that is minimal risk, meaning that the things that participants will have to do is not really out of the ordinary, and it's something they might encounter in daily life. There's a lot of different categories for what minimal risk can be, but some main ones are the research takes place in a commonly accepted educational setting. The research includes surveys, interviews, educational tests, etc. The research includes brief, benign behavioral interventions and no deception unless prospective consent. And then only written or audiovisual data is collected during this brief, benign behavioral intervention. Okay. For non-human subjects research, we mentioned secondary research and how de-identified data sets, this is not human subjects research. I want to make clear that if you are using data that is identifiable information, it hasn't been de-identified, you do not fit in the not human subjects research category. You're actually in the exemption category, and we do have a specific form for research that fits this category of identifiable information, and it's the HRP 255 SR, meaning secondary research. For all other exempt studies, you'll complete the HRP 255 for your protocol and the HRP 254 for your consent form. Once again, we're gonna talk more about that once we get through these review levels. All right, next up, we have expedited. So this is usually a more involved application process, and it may even require an annual review of your application and your research study. But generally, there's categories. This is still minimal risk research, but it could include collection of specimens, routine non-invasive procedures such as using like eye trackers, fitness monitors, EMG, and then also we see that surveys, interviews, educational tests, human factors, and task-based research is on here as well. Now, think about this. If you had, let's just say, an exempt study, so the lower category that we just talked about, and you're interviewing people. It turns out that you're interviewing people about something like suicide risk. There's a chance that that research with interviews could invoke a potential psychological risk to participants, which would automatically bump your exempt study up to an expedited study. And you can see here automatically expedited if there's possible psychological risk, or if your research involves vulnerable populations, such as children or cognitively impaired individuals. Um, yeah, so that's just something you want to be on the lookout for, especially if you're doing like interview survey research. But generally for expedited research, you would use the HRP 2 or 503 for your protocol and the HRP 502 for your consent form. All right, and last but not least, we have full board review. Now, when people imagine what is an IRB, IRB stands for Institutional Review Board. When a study goes to full board, it's actually getting reviewed by a diverse group of researchers who come from a variety of backgrounds, and they'll actually make that final determination of your research. So basically, a lot of studies that go to the full board, I haven't seen a thesis project for an undergraduate go to a full board before. I suppose it could happen. Generally, we recommend that faculty advisors lead you away from these higher risk studies, but we can talk more about that in the future. But generally, it's clinical trials, invasive procedures, extensive blood draws, or a highly sensitive nature or study population. Um, Basically, during this full board review, the research team could even be invited into the IRB team meeting, and basically answer questions from the reviewers, where and then they will formally vote on revisions to the study documents. You'll notice the templates are the same as the expedited procedure here. So you have 503 and then the 502. And if you do have any questions, drop them in the chat. I'm going to try to wait to address the questions till we get to the end. But yeah, feel free to drop them in there. All right, so for resources in completing this application, we learned a little bit about the different review levels and the main templates required, but there's some other information that you need to provide, and we do have resources that can help you do that. Primarily, our help resources are located in the Huron IRB library. Now, I have a screenshot here. This is what it looks like, and we're going to be taking a look at this in a second. But this actually lists all of our guidance information. It lists all our templates, and these are documents that you should definitely be familiar with as you're completing an IRB application. One to definitely make note of is the IRB Guidance 7. These are our study application instructions. Basically, this is a document that's going to tell you in the written format what I'm telling you right now. So it's a great thing to reference. You can also check out our UCF IRB Learning Center. This is a YouTube channel recently created to publish tutorials like this, and we'll probably be uploading this recording to that center for you. But generally, whenever you are using these resources, such as the templates and the guidance documents, you should always try to use the most current versions of the protocol and consent templates found in the library. Sometimes faculty advisors will give you a protocol, and you might be like recycling that template and adjusting it for your study. But we update our templates regularly. All of our guidance documents get updated regularly. So we recommend that you don't recycle, and you always start from scratch from the most recent version of templates. Another thing is some of these templates have instructions on them. And it's important just before you upload those documents that you remove those instructions. And we're going to talk about that more in a second. But when you do submit, your study documents need to be in that finalized state, including all of your research activities, and make sure it's proofread and check for consistency. And when it comes to actually starting that study application, you actually upload some documents. Now, you create that application through the Huron Research Suite, which I have another screenshot here that kind of shows you generally. Once again, I'm going to be sharing my screen and showing you how to do that. But generally, this is something to take note of. You'll be prompted to submit the following forms: your protocol, which every study will have a protocol, your consent form if it's necessary. So non-human subjects research doesn't require an official consent form. Your recruitment materials. So think like if you are doing a survey and you want to put a flyer around campus. This is recruitment material. If you were emailing people to recruit people, a script of that email would be recruitment material. And then we have measures, data collection instruments, and other participant-facing information. This is going to be like your survey questions, your interview questions, maybe a script that you read participants during the actual collection of the data. It's any participant-facing information. And then lastly, there's a chance you might need to submit other documents. These can include letters of support, international documentation, as well as FERPA and HIPAA permissions. That's going to be a case-by-case basis, and you can really come to that determination by meeting with me or IRB staff, and we can help you decide that if you need guidance. All right. So I mentioned this previously, but there are some best practices, some basic submission requirements for your application. And these are things you're just going to want to make sure you have down prior to submitting. For one thing, all your study documents should be attached in the correct area of the application. Your document should be that correct, most up-to-date version of the templates. Your documents are on a finalized state. This means that there's no track changes or comments on the actual Word documents. We check to make sure everything's submitted that's supposed to be there. We check to make sure that you have city training if it's required. Now, remember, not human subjects research doesn't require city training. And then all documents, including your protocol and consent form, should be uploaded in a Microsoft Word format, unless you're using a validated measure. An example of a validated measure would be, let's say you're going to be showing some survey questions to participants, but you're using a validated survey. So this is something like that's research backed. People use this to determine something about their participants. You can upload that as a Word document because you're not necessarily creating that. And then you can also do a self-check. If you're ready and your application materials are prepared, you can do a double check. Use this hyperlink and check the basic IRB submission checklist. It basically just asks you these bullet points and make sure that you meet those basic submission requirements. Now, for the submission process itself, there's some specific things to consider as a HUT scholar. So for undergraduate students, you cannot serve as a principal investigator of a study. And that's important when it comes to the actual application, because you will be including who is your PI. And for thesis research, this is generally the thesis chair or your thesis advisor who is directing you through this research process. Although you can create an application, they must be the one who takes responsibility and actually submits and says that this is ready for submission. So if your study is ever in pre-submission or clarification modifications requested, this will make more sense in the next slide, but your principal investigator will need to submit that response. If you haven't heard from the IRB for a really long time and you swear you submitted, there's a chance that your study might be in pre-submission or you didn't catch that there was a clarification on your study. And this is really gonna hinge your approval time. So basically, whenever you're going through this process, you cannot start recruitment or data collection until you get an official IRB approval letter. And this generally takes 2 to 6 weeks, but it really depends on the state of the application and the submission volume at the time. For instance, if there's a deadline coming up and everybody needs to submit their IRB application at the same time, that is undoubtedly going to slow things down for you. So try not to wait till last minute when you're doing this, especially if it's a requirement for your program or your professor. Let's see here. If your study includes a consent process, it's important that you use the finalized consent form. And this will actually have a stamped identifier showing that the study has been reviewed by the IRB. And here we are, clarification requests. I mentioned this last slide, but let's say you submit your study and your reviewer has made a comment or has asked you to change something on your study and then resubmit. You'll see that the flowchart on your study workspace will actually shift from either pre-review, IRB review, to clarification requested. And this basically means they're going to leave you a message. They're going to attach any specific documents telling you exactly what needs to be changed. So this could include moving documents to the correct section of the application, editing the actual contents of your study documents, addressing comments or track changes on your study documents, and etc. So once again, the amount of clarifications required and how quickly you respond to these is really going to affect approval time. So just keep that in mind. Now, modifications. A modification is required anytime you need to make changes to your approved study. So let's say you get approval to do your survey research and you get a couple responses and you realize, oh, I need a different question, or I need to rework these questions to work for me. You will have to submit an official modification to the IRB to get those questions approved. So just keep that in mind. You can see some examples of when a modification might need to be submitted is if there's a new consenting process, or you decide to change your study procedure, if you have a new enrollment total. For instance, if you want to have 30 people complete your survey and it's looking like you're going to do more than that, you would submit a modification to increase that maximum enrollment. And then if you're changing, like I said, your interview or focus group questions. And then here's another important one. It's your study team members. That'll make more sense when I open up the application, but you add people to your study. And in the case that you do need to make changes to that while your study is active, that'll be done through a modification request. All right. And for the last thing, I know this is going to be a while from now for you guys, but basically when you're complete, when you're all done and finished, it's required that you close your study. And now we do have a guidance video on this called How to Submit a Study Closure Request. You will be able to access it through this hyperlink in the future. But generally, research that's complete needs to be closed. And when you do graduate, it is required that you notify any principal investigators who you might be like a research assistant on their study, just so that they can make that modification and remove you from the study application. And here's another important point. Have a plan for your research data post-graduation. We haven't talked a lot about data yet, but that is a major consideration for the IRB. They want to make sure that any data you're collecting from human subjects is going to be protected and not put them in any risk. So the way you manage your data and keep it protected is a key consideration. And you should definitely talk to your faculty advisor about the proper way to store that data and the requirements for that once you graduate. All right, so we've made it to navigating the Huron IRB. Basically, what I'm going to do is I'm going to switch over to sharing my screen, and we're going to go through how to access the Huron library, find those guidance documents and templates. And we're also going to look at just creating that study application. Now, I know there's some questions in the chat. I'm just going to take a quick look before I do that.
There's nothing IRB related in there right now. It's just about
Okay.
getting attendance so you can move forward.
Fantastic. All right, so I'm going to go ahead and let's see here. I got to exit this. All right. Maggie, can you confirm that you can see my screen?
Yes, I can.
Okay,
Wait,
great.
on the PowerPoint or on a different?
On a window. Is it still showing my PowerPoint?
Yeah, you might have to stop the share and
Gotcha.
either do your screen or a specific window.
Thank you. All right, is that better? Yeah. Okay. So this is the newly revamped Institutional Review Board website. There are going to be some changes happening to this soon, such as a frequently asked questions page, which I definitely recommend that you utilize once it rolls out. It's going to give you any sort of information you need through that process. Excuse me. So generally starting here, I'm just going to click here for Huron IRB. If you've never created an account, you'll notice it logs me in immediately. When you first enter, it might have you create an account and register. You'll use your student information to do so. But yeah, this is what it looks like. This is the Huron Research Suite. You can see some additional stuff here that you won't actually see. These are some studies that are in the queue. But what I'm going to start off with is I'm going to go over to the IRB tab. And then you'll notice the secondary menu drop down right here, and you can see library. So you'll definitely want to know how to access this because odds are you'll be accessing it frequently for help. But the two, you can see we're in our library here. We have standard operating procedures. Odds are this information isn't going to be super helpful for you. But then we have the general tab. So the general tab includes annotated versions of the exempt protocol and the expedited protocol, which can be very, very beneficial for you to review. It also includes an investigator manual and our human research protection plan. So so if I was a researcher, let's say, and I have a question about city training, I'm gonna go and check out IRB guidance number 4, city training, and open it up and take a look at that. If I have a question about my advertisement and recruitment, I'm going to take a look at that IRB guidance document. And then we can also see IRB guidance 7 here. These are the general application instructions. But all I'm trying to say, if you do have a question, it's a good practice to just take a look and see if we have a guidance document on that prior to reaching out to the IRB. Now, that's our IRB guidance documents. If you see this right here, we can go to templates. And here we are, a list of 21 different templates for you to use. Now, we mentioned the different templates that are required for each study earlier on in this presentation. For instance, for not human subjects research, right at the top, you can see the HRP 250 form. And then let's see, the HRP 255, this would be the protocol for the exempt study. And then the HRP 254 is the protocol or the consent form for the exempt study. So what I always recommend that students do, if you're having trouble determining which templates to use, we chatted about it before, but I always jump over to the general tab and I just open up the study application instructions. This is 7 pages of information that's going to tell you exactly what to do. But I really like how this chart here explains what protocols and consent forms are required. And I'm not going to go over it all completely again, but you can see that human subjects research, it gives examples, and then it lists the protocol. Exempt studies, it gives examples, and then it lists the protocol and consent forms. You'll notice there's an additional form that we haven't talked about. This is if your research includes deception or incomplete disclosure, and it's part of your study design and is unavoidable. So you can chat with me about that if you think your research might fall under that category. So let's see, I'm just going to jump back over.
Can I interject really quickly?
Go ahead.
So, with the deception, I use that in pretty much all of my studies, and I use it for the purpose of not letting the participants know exactly what I'm measuring. So, if you give any sort of cover story to get a better direct observation of something, that's considered deception.
Yeah, that's a great point, Maggie. Exactly. So basically, it's got to be part of the reason, like it's got to be part of your study design. So for instance, you don't want to bias a participant. So, and for that reason, you don't tell them exactly the purposes of your study. This is deception or incomplete disclosure. There's two slightly different definitions. But generally that requires a debriefing form. So like after the whole study happens, you'll inform the participant, hey, we misled you a little bit, obviously in a nice way, in a purposeful way, right? So yeah, templates, jumping back over here, a lot of numbers and letters. I know it can be very complicated and hard to remember, but once again, always refer back to that guidance 7 for instruction if you're not sure what templates to use. Now let's see. We still got a good amount of time left, so I'm going to go through the process of creating an application. It's not going to include any like actual study information or anything, but I'll show you how to actually upload materials. So we're back on the Huron Research Suite. I've clicked on IRB. And then when you just click on IRB, it brings you to this page. You won't see all this, but I'm going to go ahead and select Create New Study. All right. All right, so we can see basic study information. This is the first page of our study application. This page has to be complete in order for you to continue the rest of the application and or save and exit. So I'm just going to put a letter in here so it lets me proceed because you can see there's a red asterisk. It is required. Um, Another thing I want to point out really briefly is if you're ever not sure what to include in any of these sections, you can always click the question mark there and it's going to tell you exactly what to include. Um, but generally, you include a title, a shortened title. This is really only if your main study title is like super long. If it's not, you can just repeat it. You're going to do a brief description. What kind of study is this? Of course, most times this is a single site study. If you want to look more into what a multi-site or collaborative study is, you can click this question mark here, but odds are for undergraduate honors thesis, it'll be a single site study. Will an external IRB act as the IRB of record? No, because you're using UCF's internal IRB. You'll notice local principal investigator, it's automatically listed my name. So um, if I was an undergraduate student, I actually couldn't serve as local principal investigator. So right here, if you want to update this to your faculty advisor, right when you get to this section, you can look for them, select their name, include and hit add. And that you're going to want to do that at some point, but you can do it right away. And then you're going to answer this question about financial interest related to the research. All right, attached protocol. This is where we include a protocol. Every application requires a protocol. I'm going to select add, choose file. Let's see if I have one handy here. I'm just going to add something. I'm going to name it protocol and I'm going to call it version number 1. And the version number is important because there's a chance that you might need to make updates to your study application. Every time you make an update, you will upload the subsequent version number, right? So we've met all these requirements here. I can either save and exit, come back later if I want, or I can hit continue and it's going to open up the rest of that application for me. Sometimes people are confused and think that first page is the whole application, but you have to upload a protocol in order to access the rest of the application. All right, so next up, study funding sources. If your study has funding, you would include it here. If not, you just leave it blank. Let's see our question mark here. This helps you with locating your study funding information, if that is an aspect of your study. I can either hit continue or I can just go on to the next section in this list here. Local study team members. Okay, this is important because this is where you're actually going to include yourself. So you are acting as a sub-investigator, as like your principal investigator is like officially leading the project. Of course, this is the honors thesis. We do expect that you are creating those application materials and creating this study at the guidance of your faculty advisor. So you're going to be as a member of the local study team, and you'll answer any of these questions as it relates to your participation in the research. External team member information. For this example, let's say I have a committee member who is not at UCF and they are involved in the design, conduct, or reporting of my research. I would add them. This does require a couple different forms, but it's something that you can locate in the templates library. I'm going to continue on to study scope. We have these 2 questions about the use of a drug or biologic. Most cases for undergraduate research, these questions are going to be no, but this is something you want to check with your advisor and or look more into these questions. Local research locations. Let's say your research is taking place in a physical location. So you're stopping people and interviewing people on campus, for instance. You would include that physical location of where that research is taking place. Now, if your research is strictly online, you would actually leave this section blank. Yeah. So, all right, we're getting to the end here. Local site documents. This is the only other place in the application where you upload like files, like documents, like we did in the basic study information. We uploaded our protocol. So now, if your study has a consent form, requires a consent form, you upload it here. So I mentioned that not human subjects research doesn't require an official consent form. However, exempt, expedited, full board reviewed studies do require consent forms. So I don't think I have one in my recents here, but I will just show you the process, just uploading a document. I'm going to name it consent form and I'm going to call it version number 1. All right, and you can see it's appeared here. Now we have two other upload areas. We have our recruitment materials and our other attachments. We mentioned this earlier in the presentation, but generally speaking, recruitment materials are going to be any materials that can be seen or heard by subjects or potential research subjects. So let's say here an example could be, this might not be relevant to HUT student research, but maybe you've been listening to the radio and you've heard like an advertisement come on the radio and say like, we want to invite you to take part in our research study. That had to get IRB approved. And basically that's an example of using audio to recruit subjects. You would upload that audio file or template. A more common example for our purposes is going to be like a flyer, an email script for recruitment, a phone call script for recruitment, things like that. Now, for other attachments, these are going to be materials that participants encounter after joining your study. So this is going to be like your survey questions. This is going to be where, let's say they're going through an intervention process. You're going to be all the sort of materials that they will encounter. Let's say if I was doing research where I wanted to show participants images or videos as part of that intervention, I would include those images or videos in this other attachments. I'm going to click the question mark here, and it'll also mention your letters of support. So there are some documents that could possibly be required. For instance, a letter of support is basically, let's say you were doing research at a specific, let's just say a facility, a nursing home facility. A letter of support would be like an official letter from the people who run that facility that says that they agree to let you conduct your research there. It's not always required. It's definitely a question you want to ask your faculty advisor if that is relevant to you. All right, and we're getting to the last page of the application right here. Additional information. This is where you're going to describe the description of the principal investigator listed on this study. So since you're listing your faculty advisor as the principal investigator, I believe you would answer one of these referencing your principal investigator. You're going to answer if the research is taking place online. Let's just say no. Does this research include any of the following? Now you can see these are like vulnerable populations. I mean, you can see UCF, that's not necessarily a vulnerable population, but if your research specifically targets any of these groups, you'll want to share that information. And then we have, does this research include accessing student, employee, or medical records at non-UCF institutional populations? If this answer is yes, you are required to upload like a permission letter. And I mentioned that approval letter earlier. You'll just click this question mark here and it'll give you more guidance on what to include there. But I'm just going to say no. You can see that disappears. Will this research be conducted internationally? Here's a note. This is only referencing like if you're doing international field work. If you're, let's say, a survey that's getting posted online might be completed by people in different countries, it's not considered international research. I'm going to select no. And then that's it for the application. I'm going to hit continue. Oops, I'll select that. Oops. Continue. All right. We can see this finish page. Some people get confused and think that when you hit finish, you're submitting. All this is doing is bringing you back to your study workspace. All right. This is your study workspace. You can see this is where your title of your study will be included. It's just a T because that's what I put. Principal investigator will be listed right here. And then you can see this flow chart. This is going to be really beneficial for determining what point your study is in the review process. So pre-submission, your study isn't going to get seen by anybody. Only people who are local study team members are really going to be looking at it. It doesn't get assigned to a reviewer at this state. In order to leave the pre-submission state, the principal investigator has to select submit. I once again want to emphasize that your faculty, as undergraduate students, your faculty advisors will be the listed principal investigator. Hence, they will have to come in and hit this submit button. However, as a local study team member, you will be able to still access and edit the study. Once your faculty advisor hits submit, your study will go to pre-review, where our pre-reviewer will be taking a look to see if you meet those basic submission requirements, which we discussed earlier in this lecture. If it doesn't, they're going to tell you exactly what to do, such as remove comments or track changes from a document. They might also tell you to move documents around in the application. For instance, if you uploaded your consent form into your protocol section and your protocol section in your consent form. Once you get past that step, your study will be assigned to an IRB reviewer. They're going to be looking at all your study materials, including your protocol, consent form, recruitment, and other study materials. And they're going to be really looking out for the protections of the human subject. And that's really what they're focused on. They may require certain changes. They might even make annotations on your protocol document or another document. Send it back to you and tell you to address those changes. So they'll send any information back to you, and you'll notice clarification requests in this sort of area down here. You can't see it right now because this study's in pre-submission and doesn't have a clarification request. At that point, once your study's good to go and you've submitted any required clarifications, all your documents will be finalized and a final outcome letter will be provided to you, and you'll be ready to conduct your research. That's pretty much the main gist of the application. Once again, I do want to emphasize the library here. The general tab houses all those guidance documents that are going to be really helpful for you in creating this application. Yeah, and that's pretty much it. So I'm going to stop sharing. I'm going to open up my PowerPoint one more time. Share.
I'll add something really quick, just
Go
from a
ahead.
researcher perspective. If you get any clarification requested or anything, get on that as soon as possible just to avoid any delays. And again, like Zachary said, the PI needs to click submit, so make sure you're in contact with your thesis chair, letting them know, just to avoid any delays in the process.
Yeah, definitely. I know, our policy at the IRB is to focus on, your advisor should really be guiding you through the process from start to end. Of course, it doesn't always happen this way. We have to plan for reality. So, yeah, but generally speaking, if you're not getting a lot of feedback from your advisor, that's something that you can mention to us at the IRB, and we can see how we can help you out on that. But we've made it to the questions and discussions. We have about 10 minutes left, but I just want to go over a couple things here. If you do have questions about your IRB application or anything at all, you can email me directly with your questions. I also offer one-on-one office hours with student researchers. I'm available Monday through Thursday generally, and you can reach out to me and schedule a meeting with me by emailing me. And you can do it that way, or you can even visit the IRB website to find a way to contact the IRB ambassador that way. And then we also have some information for Maggie down here. So you can schedule consultations with Maggie, any methods or statistics related questions. You're going to email over to Honor Statistics. And then if you do have any questions specifically about your HUT requirements, deadlines, definitely reach out directly to honorsresearch at ucf.edu. But yeah, I'm going to stop sharing my screen and feel free, you can raise your hand or you can just speak up if you have a specific question about your research or anything like that. We do have about 10 minutes, so feel free. Okay, I see a hand raised. Go ahead, Colin.
I have a specific question about my study, but it's only one, so I don't really think it would make sense to make an appointment. But basically, I'm going to be interviewing ED, the emergency department providers, about their experiences with interpreters for patients. So at what point would I need to be worried about HIPAA? Like I'm just about to send the IRB, well, I'm about to tell my supervisor to send it in. So I'm just confused at like what point I would need to get like permission from the hospital of it's like going to be on Reddit that I'm posting for recruitment. So it's going to be like multiple providers from different hospitals. So I'm just like, do at what point do I need like HIPAA or I don't know.
Yeah, great question. So it really hinges on like what sort of information you're collecting. Um, so you mentioned are your interviews or surveys?
Interviews with providers, so about their experiences with Spanish interpreters. So, for
Okay.
example, whether they used a Spanish interpreter, what went well, what didn't go well, For example, like, do they have a situation where they didn't use an interpreter and it didn't go well? That kind of thing. So, like, obviously, I would encourage them not to give personal patient information, but
I can jump in on this if you want, Zach.
Oh, thanks. Yes, this is Renee Carver, one of our IRB managers. So feel free to hop in on this.
So what you're talking about, Colin, is really not going to fall under HIPAA protected information because
okay,
you're just talking to the provider
cool.
themselves. And I'd say since you are recruiting through Reddit, we probably wouldn't even be looking for permissions from the local hospitals
Yes,
themselves. Let's say if you were going into Advent Health and specifically looking at talking to their providers,
right.
we would want some kind of permission from somebody who had responsibility over your population of interest. But don't worry about any HIPAA in this case or permissions.
Wonderful. That's kind of like what I was thinking, but okay. Thank you.
Thank you for your question.
I
Let's
have a
see.
question.
Go ahead.
Last year in about the fall semester, I was going to do my undergraduate thesis. I was going to do it interdisciplinary in the psychology department, and I completed city training for social and behavioral sciences. But that changed, and now I am doing my undergraduate thesis in my major of anthropology. And the research that I'm doing is still going to be social and behavioral. Does my city training is it still active? Like, do I have to redo that, or what's the case with all of that?
Great question. So, since your research will still be social and behavioral, I believe you should be fine with that. I think city training expires every like 3 years or so. So
Okay.
as long as you haven't reached that expiration date, um, I think you should be fine.
Okay, thank you. It should still be active, all good.
Yeah,
Okay, thank you so much.
of course.
I
Is any
have,
Go
yeah,
ahead.
I have a question about, how to apply with my research. I'm actually doing a creative honors undergraduate thesis project where I'll be producing an educational video series on rhetorical theory. And filming will take place in like public spaces, like maybe a park or a library, or maybe even on the street. I might ask informal or spontaneous questions, and people would be identifiable through their face in a video. What sort of application process would I need to go through for that?
Renee, do you want to weigh in on that?
Yes, I'm guessing that, it kind of depends on the questions you're going to be asking your people in the field. So if you're asking them something that's very, very specific about a thing, that's probably going to be not human subjects research. If you're
Yeah.
asking them questions about themselves, that would be human subjects research. So if it's the first, you're going to apply for not human subjects research determination. And if you have people that you might want to use their video, there is a media release form that is issued through our general counsel office and it's part of our library tools. So as you're meeting with people out in the field and you want to include them in your video, you would have them sign off on those media releases.
Okay. That answers my question. Thank you.
Great. Go ahead, Colin.
I just realized I have one more question. So for the exempt, the IRB exempt type of study, obviously I'm making the consent form for the explanation of the research, but I don't need to collect consent, right?
So it's an informed consent process. So with exempt studies, you're not like getting signatures or
Right,
anything,
okay.
but it's still expected that, each participant is given that explanation of research. This is my research.
Mhm.
This is why it's being conducted. Here's why you're being asked to participate.
Perfect. Thank you.